You may be struggling with a loved one's illness right now, and you no doubt have had a loved one who has died from a medical illness. That loss may even have been the reason you went into healthcare. This episode reminds us that a patient is more than just the person we see at the time of illness, and that we can help both patients and their families as the end of life approaches.
In 2016, my mom was diagnosed with dementia. My father was diagnosed with cancer. My father was diagnosed 2 weeks before his 90th birthday. The idea that my mom had dementia was stressful enough, but within 6 months to find out that my dad had cancer, I couldn't talk to my father about his final wishes. Maybe it's just, I don't know, favorite daughter, only daughter. But I asked my brother to talk to my father about what was important to him, what he wanted. And he said he could do it, and he did. He recorded it, and I listened to it. And it made me confident and sure and feel okay with the choices we had made. Hospice was the right answer, and we could not have asked for, I don't think, anything different. In my mother's grief and with what I thought was dementia was actually her concealing the fact that she had breast cancer. It had been going on for quite a while. By the time we got to the hospital, the diagnosis, there was too big for surgery. Chemo would do more harm than good. So there was nothing to do but try to keep her pain-free and comfortable. As impossible as the situation was, as hard as this was to hear, there was caring from the caregivers. They understood and appreciated what we were going through, and I was grateful for that.
My husband, he went in for a colonoscopy, and that's when we got the bad news that they did find a quite large colorectal tumor. His final surgery was intended to be a 5 to 8 hour surgery if they did everything that they wanted to do. Within an hour, I had gotten a page to come back to speak with the surgeon, and he told me that the cancer was in the base of his spine. It was out throughout his intestines, small and large. To do any good for my husband, we weren't talking cure anymore. We were talking management, given that we knew at that point, after that last surgery, that was in his spine, his small intestines, encasing his bladder. I don't really understand why the word terminal didn't come into play at that point. My husband needed to hear from a professional. He wasn't going to believe anything his wife had to say, even though I had knowledge in healthcare. My niece was visiting us at our house. I had just gotten off the phone with pain management, who refused to refill his prescription without him coming into the office. I told them it took 4 people to get him into my house several days ago. How many people do you think it's going to take to get him out to come see you? And they denied me. I pretty well threw the phone across the room, which made it fairly aware to my husband as well as my niece that things weren't right. At that point, my niece just instantly went into the discussion of hospice. He finally agreed hospice was the right idea then. By the next day, I had it arranged, and a nurse stayed with me all day. Once in hospice, it was maybe the most relaxed piece of time. The hospice doctor had come to me the night he was admitted and asked me to sign DNR papers for my husband. I don't think my husband would have understood the things that could happen to his body in code. Broken ribs and whatnot, more pain. If he went into code and they performed CPR, it may have allowed him to live longer. Doesn't mean that he would live in comfort. I think people need to be aware of what happens by making those choices. How do you want to end your life? In pain or in some amount of comfort, as much as can be provided? No one wants to be in my situation. What I had to do was, it was a nightmare. I did as well as someone could, but I also had children. I needed to push through for them. Those things are what made it possible for me to keep going and keep doing what I was doing.
We want our patients to get the best care possible. And in my mind, to be the best care possible, it has to be in line with the patient's values and wishes. And that's after they're given honest and empathic predictions for what their future health may entail.